Hi, this video is the hair transplant journey from Ken. He's gonna share his personal journey for the audience to understand his journey. And before we do that, I'm gonna show the audience what Ken look like, and then see the result. It looks fantastic. He has really good result, and actually, he initially he came with his son, and it's for his son, but end up he did the surgery first. Um, so he's thinning front toward the back. Very thin hair, and that's a year later. Very good volume and density, mostly all gray on top, and now it's darker color. The reason it's darker color is we harvest hair from the back of the head. You see, top view, top view. And now I'm gonna leave the stage to Ken. So go ahead, Ken. Can you start from the beginning for me?
Well, sure. To begin with, as you pointed out, I'm here talking to everyone who happens to be listeners, which is not something I would normally do, but I was particularly pleased with the work that you did and the results that were achieved. And I didn't expect it because I had actually consulted with my doctors who are at Stanford and at Palo Alto Medical Foundation, and they both advised me against this sort of thing. They thought that ship had sailed, it was too late, and I wasn't likely to get any real benefit from doing it. I was also someone who had gone through cancer and treatments for chemo, radiation, and so forth, and so they particularly thought it wasn't a good idea. But I just decided to go ahead after joining my sons, and they actually, the doctor, which another point of credibility, advised them that they didn't need it, that they could just use Rogaine and Percussia and try that out, and it worked for them. But in my case, I was at a point where going outside was an instant sunburn on the top of my head, something I hadn't had before. It was pretty clear I was going from very, very thin to bald pretty quick, which wasn't really sure I was ready for that look. The truth is, I did not find Dr. Diep. My son researched around. He's kind of clever at researching. Discovered that he was the best doctor in the Bay Area for this type of thing, and in fact, many people fly in from far away in order to see him. And long and short, I was very impressed with the results. Decided to go ahead and initiate the surgery. I will say that the surgery's gone, then it's fine. While it's going on, your face is turned a different color and you're kind of swollen up, and it wasn't entirely pleasant, and it wasn't entirely pleasant sleeping either. But I think, I can't remember exactly, I think it was probably 3, maybe it was 4 months later, it was clearly growing in, and it continued to grow in, and it grew in thicker, and plus I had some of the original hair still there, and I think I had been told that it was going to fall back out again, but it never did. It just stayed, and has been very easy and effective to manage. It's nice. I will say this: my wife appreciates it. She had originally complained that because I didn't dye my hair, people didn't think she was a natural blonde anymore. And then I was going bald. She said, "Well, now they really can't believe it." And now that I've got it, and not only that, because I don't use any dye, but it's a little bit darker, it's making her feel a lot better. And so it's just nice. And I go to Kauai relatively frequently, and so now I don't have to worry about the top of my head burning either. So everything has worked out very well for me. I'm better than a year post surgery, and feeling very good about it.
Yeah, thank you, Ken, to share your personal journey with the audience. So with for your surgery with hair, actually there's 2 benefits. Number one, you have hair, so you look younger. But number 2, with hair, actually, it prevents you from getting burned on top of the head.
Yes, yeah, absolutely.
And because your history of cancer, you don't want to risk of skin cancer too as well. So because if you get burned so often, there's always a risk for that. And so there's a benefit not just for look, but for prevention as well. Well, I don't say this is cure for prevention for cancer, but at least for Ken, that helps him a lot. And it's pretty brave that Ken actually show the full face and actually share his personal journey about his cancer. People with chemo, they tend to lose hair. A lot of time, most of the hair will grow back, but not everybody. I found out that a good 20% of the patient, their hair will never grow back, and then they will lose it. And then so then most doctors say, well, it's not, surgery not going to work. But reality is hair transplant can work for some patient.
Yeah, I will say this, by the way.
Mm.
It was a different doctor, but nonetheless a skin doctor at Stanford who looked this over and thought it was the best job she'd ever seen, recommended it to her assistant who is bald, and my wife's hairdresser, who had hair transplants done himself and sees a lot of had said that this was also the best one that he had ever seen.
Oh, thank you, Ken. And for me, you know, with my career, it's one of the greatest benefit, and I take the greatest satisfaction to realize that, you know, with hair transplant actually can make a big difference in people's life, and seeing how it helps you, and what my other client is, that's one of the benefit of being a hair surgeon. So again, thank you for Ken. I hope the audience learned quite a bit from him and the journey through hair transplant. Not everybody recovery going to be perfect, and I'm glad he's honest about it. But most of my clients say, you know, their recovery is fine. They have no problem with it. But some people it's a little bit more rough. But the most important thing, in the end, the result going to be good.
Yes.
Thank you.
Thank you.